my name is Rick, and I'm a cancer patient. And it's kind of interesting how this whole thing started. I was very healthy, very active, and I ate fairly well. And all of a sudden I developed pain in my back. And the pain began to increase and get worse, and came on all of a sudden. And as the pain increased, it got to the point where I couldn't sleep, and I had a difficult time sitting and even standing. And I eventually ended up in emergency. And when I went to emergency, the last thing on my mind was that I had cancer. And after they ran some tests, the doctor told me that I had lymphoma. And that was kind of a shock for myself and my wife. And at that time, we were kind of not knowing what to do. And one of the things that the doctor did, because I was in such pain, he gave me pain medication, which at that time I was looking forward to because I had such severe pain. But what it did is it kind of clouded my judgment in how to proceed with this cancer issue. Anyway, what the doctor at the emergency did was refer me to an oncologist. Which was kind of interesting. Instead of going back to my primary care physician and having him request a biopsy to, first of all, to confirm the fact that I had cancer, what he did was send me to an oncologist. And I went to the oncologist, and they did a biopsy, and I did in fact have lymphoma, B-cell lymphoma. And one of the things that happened is that, I had family there, which is kind of interesting. And my family is in the medical, my daughter is in the medical profession, my nephew is a doctor, and so in their mind, the only avenue for me to take was to take chemo. And when I met with my first oncologist, he told me the type of cancer I had was somewhat aggressive, and he said that I had to do something quickly, and that would have to be my decision. My wife and I had decided if anyone was going to make a decision, it was going to be my decision and what path I would take. And I'd have to say I was experiencing a lot of pain, and looking back at that time, my mind wasn't as clear as it should have been for me to make that decision. In any event, given the pressure from my family to go chemo, the pressure from the doctors saying that I didn't have a lot of time and that I needed to do something, I decided to take chemo. And what they did is they gave me a dose, they called it R-CHOP. And it was kind of interesting. I always thought to myself that I was a pretty healthy person, and I just thought that I would walk through this chemo, it'd be an easy trip for me, and that after I had chemo I would be healed. Well, it wasn't like that at all. I took the chemo, and it just devastated me. I got so sick. What happened is that it took away the pain that I was experiencing from the cancer, and it created a whole new set of problems. Anyway, it started a whole new set of problems. I started having stomach trouble, and I was unable to eat for a week, maybe a week and a half. And I started losing a lot of weight, and I had a lot of stomach pain. And so what that required me to do is continue to take pain medication. I was taking OxyContin. Anyway, I was kind of in a daze that whole time, and I finally figured I need to do something different because I was so sick, and I became so weak because I couldn't eat, and the chemo had such an adverse effect on me that I knew I had to do something different. And my wife, and I'll let her tell this story. My wife had found something that she wanted to share with me. Why don't you tell them what you had done, hon?
Well, several years ago, I had been looking for a place that would perform thermography, and I heard about Dr. Nezami's office, and I said, "Oh, okay." So just recently, my niece was telling me, because I was looking to go to City of Hope. I'm looking for natural remedies. I wasn't really wanting him to go the chemotherapy route because I knew how devastating it could be. And so what I did was come over here. I actually drove to the location, picked up a pamphlet, and brought it home. and contemplating whether or not to make an appointment. Like you mentioned, we had family around and everyone is pushing, for chemo. And I did bring the pamphlet home and shared it with the family, but no one seemed to be interested in it. So meanwhile, prior to him having his first chemo, I went ahead and made an appointment. But I couldn't get in any sooner. Dr. Nezami would not be available until the following week. So what happened, he had his chemo treatment, and then the following week we met with Dr. Nezami here, and we started his protocol, which it was God sent, because it started to help him to rehabilitate, because he was very sick, and I was concerned that he was very weak. And there was no way he could do another 6 or 8 rounds of therapy and survive and come back. So we are very happy to be here. And we are thankful that there is someone like Dr. Nezami out there that is willing to do this. And this was a leap of faith with many prayers on our behalf. And then I'll have Rick give you the test results after 10 days of being on his protocol.
Yeah, and I was going to say that, I was very sick, and I don't think I could have gone the 6 to 8 rounds of chemotherapy that they had recommended. And when I came here and started to get the IVs that Dr. Nezami had recommended for my condition, I started to notice feeling better immediately. And I don't think that I would be where I'm at today. I've only had the 10 days of IVs, and I'm starting to feel like my old self. I'm starting to have the energy that I once had, although I'm about 20 plus pounds lighter than I was before. I feel really great. But one of the things that Dr. Nezami does, he takes a very common sense approach to cancer treatment. And what I found very interesting is that he came up with some indicators. And one was an IGF-1, which shows the growth factor of cells. And obviously, cancer cells multiply at a greater rate than other cells, and what they do is they check the blood to see whether or not that's taking place. And when I had my first treatment, I was beyond the normal range. I was at 719, and the normal range is 47 to 192. I take that back. My range, my initial range was 213, and the normal range is 47 to 192. And now my IGF is 117. It's within the normal range. And then the IL-2 receptor alpha, and I was at 719. And if you had more than 710, you were beyond the range. I wasn't that far out where I couldn't overcome the cancer, but it was above the normal range. And the range was 223 to 710. And after 10 days of treatment, I'm at 427. I'm well within the normal range. So all my cancer markers are coming down, and then the lipid associated salicylic acid, I was at 24, which was high. It was above the normal range, which is 20 and below is normal, and now I'm at 14. So I'm very optimistic, and I feel very good. Mm-hmm. And I believe that in going this way, that I'll be able to get my cancer under control and get rid of it, and not have to go the conventional route, which I think is, if I had gone the conventional route, the idea is that the chemo, it would be a race between my immune system and the cancer to see which one wins. And I think if I would have gone the conventional route, I think the cancer would have won. In going this way, I think I have such a better chance of overcoming cancer. I feel very, very optimistic, and I believe that with Dr. Nezami, that I will be cancer-free. Yeah, based on my experience, what I would do is I would ask people that they're facing cancer, the same thing that I was looking at, or different types of cancers. I think it's a good idea to explore other options. Conventional medicine has but one option, And they have a set protocol on how to treat every case. And given my situation, I can see that your treatment has to be personalized. Because after one session of chemo, I was totally devastated. If I continued, I would have lost a tremendous amount of weight because it affected me adversely. And I think everyone should take charge of their own medical treatment, and they should make decisions based on information that they receive from multiple sources, so they can decide what treatment is best for them.
Best option.
Yeah, the best option for them. I highly recommend that to take control of your health, and especially if you have cancer, because it's such a serious disease.